Hi, my name is Katherine Kiefer, and today I'm going to be discussing the overall and specific impacts of inflation on low-income U.S. households. I will be emphasizing the importance of this complex problem, as well as providing potential solutions. There are various factors that lead to inflation. This includes both calculated efforts by government officials and external forces, such as the COVID-19 pandemic. Fiscal policies that have been implemented by the government put excess money into the economy, which increases the rate of consumer spending while supply has yet to increase. This drastically increases the demand for various products and drives companies to inflate their prices. A high unemployment rate is also a leading factor in inflation and low-income families' ability to keep up. With a large amount of people searching for jobs, companies do not feel the need to raise their wages and provide people with adequate income to combat the increasing cost of goods. The Phillips curve demonstrates the correlation between inflation and the unemployment rate. It shows that when inflation is high, unemployment is low, and vice versa. In order to combat inflation, we have to also address the unemployment problem in our country. In recent years, the government has attempted to change the definition of inflation and what it means to be living in poverty. Currently, someone's status of poverty is measured using the Consumer Price Index, which measures the average cost of living and what annual incomes reflect being impoverished. The alternative way of measuring inflation is using the chained CPI, which takes into account substitutions that customers make for cheaper products. As noted by Bryce Cover, right now, a family of 4 must have an income of $25,750 or less a year to qualify as poor. What the government wants to do is use the chain CPI to determine the poverty line. This ultimately creates a faulty reflection of increased inflation because it factors in when people substitute purchases for cheaper options rather than determining how one product's price has inflated over time. Using the chain CPI instead of the Consumer Price Index to measure inflation could be devastating for families already living in poverty. Families who still struggle with the effects of inflation because they live in poverty would no longer have access to low-income specific benefits. This means more than 300,000 children would lose access to Medicaid or CHIP, and more than 250,000 seniors and people with disabilities would lose help paying for Medicare health coverage. Additionally, in 2018, the Council of Economic Advisors suggested determining the poverty line based on what families are spending rather than what they are making. This would also drastically decrease the number of families considered poor yet are still struggling to make ends meet. There are countless ways that inflation impacts everyday families living in poverty. Specifically, there's been a drastic increase in the cost of necessities. This includes, but is not limited to, gasoline, groceries, insurance, and housing rates. Specifically, from 2021 to 2022, the expenditures that appear to be most affected by the U.S. inflation are housing, transportation, gasoline, and oil, and personal insurance. All of these purchases are necessary to maintain a sustainable quality of life. Increased housing costs and lower wages is reflected in 2014 data where the U.S. household median income in 2014 was 28% higher than it was in 2000. But the cost of living in 2014, measured by the Consumer Price Index for urban consumers, was 37% higher. In 2021, it was noted that consumer prices have gone up 6.8% over the last 12 months, the greatest rate increase in 39 years. This drastic increase in the cost of living, yet the average income struggles to keep up, creates an even higher rate of inflation that low-income households cannot manage to afford. With limited affordable housing and a continuously growing population, many families or individuals are forced to live in less than ideal conditions in order to have shelter. Data collected from the LA County government and the U.S. Census Bureau shows that overcrowded housing was found to be a major risk factor for COVID-19 mortality and served as a better predictor of number of deaths in a city. Inflated housing rates are not only causing overcrowding, but it is leading to increased cases of COVID-19 and other illnesses. Inflation's impact is demonstrated not just in the increased prices of gasoline or groceries. It is also seen in the increased need for medical attention in low-income populations because of the lack of adequate and affordable housing. It is known that low-income adults in the U.S. are more likely to have chronic medical conditions, serious mental disorders, and addiction problems. Studies done on the impact of the COVID-19 pandemic have reported that subgroups in the U.S., such as women, racial and ethnic minority groups, and immigrant communities experienced greater negative impacts on health, socioeconomic well-being, and access to healthcare than others in the general population. The heightened risk of health issues for low-income individuals, combined with their limited access to healthcare, heightens the mortality rate for low-income individuals. COVID-19 proved to amplify the impact of inflation, as there was an increased need for medical care in low-income communities, but a lack of affordability. The effects of inflation even affect children. Grade inflation has become prominent in various schools that are typically attended by higher-income Americans, who are also much more likely to be white. Children who are members of low-income families are subjected to lower grades compared to children of high-income families who attend private or suburban schools for the same exact quality of work. This leads to high-income children having greater opportunities for furthering their education in college and ending up with a higher-paying job. Children of low-income families are now being subjected to disadvantages in the education system due to their economic status. This decreases the chances for many children to break the cycle of poverty. Inflation remains a complex problem that increasingly affects low-income families every day. In order to find a solution, we have to look at the many small impacts it has on our society. As Eric Berlow suggested, for any problem, the more you can zoom out and embrace the complexity, the better chance you have of zooming in on the simple details that matter most. Inflation has significantly impacted access to affordable housing in the U.S., and David Schwartz, the vice president of the Denver Office of Economic and Planning Systems, suggests that to combat the effects of inflation, we can start with improving people's access to affordable housing. Schwartz suggests that local government should seek funding and support to support workforce housing development, as well as complementary funding for low-income housing development. In order to do this, local governments can seek outside funding through various grant opportunities, including the Community Development Block Grant and home funds with the Department of Housing and Urban Development. Local communities can also recruit institutional partners to combat rising housing costs. In Durham, North Carolina, the Duke-Durham Neighborhood Partnership was founded in 1996 and has raised more than $12 million to invest in partner neighborhoods. Inflation can be effectively fought through these efforts done on the local level throughout the entire country.